for you to pass a concurrent resolution, to put the task force in place, to put in the sweat equity, and to bring us some of the most meaningful legislation I've ever seen. You, sir, are to be commended.
And it's a crisis where many mothers have to suffer in silence because they don't even know what they're experiencing. So the work, they really deserve the credit for doing the work, and the coalition that they built was phenomenal. It's one of the most organized and well put together coalitions that I've ever seen around a particular interest.
Mashawn is right.
Take your time.
It doesn't always show up as tears. Mothers can't always function in their day-to-day. So some mothers may go home, fathers may come home, and they may have cried in the shower all day and put on makeup before they came in. Because sometimes you have to present front in your children and in front of your spouses. So sometimes it doesn't always show up that way. So that's why having that conversation with the provider, whether it's the OB, and mothers don't always go in for that postpartum checkup. That's why the pediatrician is a good checking point, because they go in for that 1 month, that 2 month, that 4 month, and that 6 months check-in. And then the pediatricians sometimes are the ones that see the signs, that how are you caring for your baby? Are you changing the diapers? Or what things are going on that you're actually missing? And so this is why it is actually important. And you ready?
Thank you. I would just echo with what Chairman Bagley said and what Ms. Tarver said, is that it doesn't always show up. I've been very transparent with policymakers, community organizations, and have become a really strong advocate for maternal mental health, particularly after experiencing the preterm birth of my daughter 4 years ago, born 3 months early. And research shows that 60% of NICU families, or families that have babies that are hospitalized in the NICU, are at increased risk of developing perinatal post-traumatic stress disorder. And my husband and I experienced this firsthand. And because of my maternal child health background, working for March of Dimes in a position similar to Robin's for 12 years before becoming a maternal child health lobbyist, I just did not know. I mean, I had the research, but I had not seen it, because a lot of times we don't slow down to see it. So I'm guilty of that and glossing over. But then also a lot of moms and families don't feel open to talk about this. There's a lot of stigma associated with mental health. But what I do know is that after that experience happened to me, after I presented with postpartum anxiety a few months after, I was here lobbying, talking to a lot of you 4 months after my daughter was born, losing my milk supply, because there's no pumping station here, by the way, and really stressing out about not being able to just be my normal self, and wondering if the governor's office saw that when I met with them, wondering if many of you saw just how anxious I was as I met with you. But my own pediatrician, the wonderful team members in the NICU who cared for my child and who were supportive of me, because I knew many of them before even being a patient, or my child being a patient, because of my work with March of Dimes. After leaving the NICU and becoming this advocate, talking to them about my struggles and struggles of other people, they said, "But you look just fine." I said, "Why didn't you screen me?" "Because you looked like you had it all together." But I was crumbling inside.